Welcome to our inside tour here at Fairview Pharmacy Services of our specialty pharmacy located in Minneapolis, Minnesota. We have 125 employees who are passionate about patient care. Our pharmacists, nurses, technicians, and shipping personnel work together to provide an exceptional experience for your patients when you prescribe a specialty drug. Today, we are going to take you behind the scenes to show you how these members of our team service you and your patients. Thanks to your support, we are the largest health system-owned specialty pharmacy in the nation. Coordinating care with your clinic provides an innovative, patient-focused approach to specialty pharmacy we are proud to offer patients. On this tour, you will see the extensive resources that we've put in place for your patients to make sure they get started on their therapy quickly, to get the best results with the lowest costs. We also want to make sure that your staff is able to move tasks that they would normally do, like prior authorizations, to our team.
Pharmacy services over 8,000 specialty patients and services all 50 states. This means we can provide uninterrupted service for our patients who are traveling or may spend winters away.
We aren't just a specialty pharmacy, we're a full-service pharmacy. We can handle all of your non-specialty medications and send them along with your order.
Some of the benefits that the specialty pharmacy provides are that we call patients before every anticipated refill, typically 5 days before medications are due, to set up next refill and find convenient time for delivery. With each of these calls, the patient is offered an opportunity to speak with a pharmacist.
Our phone techs are well-trained and dedicated to helping your patients to accurately fill their orders and giving them that personal touch.
All our calls are answered live. We don't use a phone tree.
For new patients or new therapies to existing patients, the prescription will stop in a queue where the pharmacist can check it for accuracy.
From there, the prescription will be reviewed by a patient financial advocate, or as we call them for short, a PFA. Our specialized PFAs work with each patient to make their medications more affordable. The PFA will perform a benefits investigation and run a test claim to the insurance. If a prior authorization is required, they will reach out to the patient to provide them with a status update. From there, they'll begin the PA paperwork and seek out additional financial assistance if needed. Our PFA team completes nearly 1,000 PAs every month. We also secure financial assistance for almost 2,300 patients every month. We estimate that we will secure over $10 million in financial assistance for our patients this year.
We also house the central PA team here in the specialty pharmacy.
This team works on all of the prior authorizations for non-specialty medications sent from Fairview and University of Minnesota providers.
Once a PA is approved, the technician will reach out to the patient to schedule a delivery date. Once the delivery is set up, the technician will transfer the patient to the pharmacist to do counseling on the new medications.
Our pharmacists receive training on specialty therapies our patients use and are a valuable resource for our patients.
We have 2 pharmacists in our specialty pharmacy check the data entry accuracy of all new prescriptions before it is sent to be filled. Our pharmacists are also reviewing every new and refill prescription that is ready to be delivered to make sure the data was entered accurately into the system and that the therapy continues to be safe for the patient.
As you know, a patient using multiple pharmacies is not ideal for patient care. We help resolve that issue by being able to ship any medication, all medications on a patient's profile to them in one delivery.
After all the clinical pieces have been verified, the prescription comes back to us in the fulfillment center. We have a lot of automation and technology that assists us in our filling of a prescription back here. We have OptiFill Fast Fill and Icon optical counting machines to assist in our processes. With our automation and highly trained pharmacists, we're able to do a large capacity of prescriptions every month. Currently, we do about 40 to 45,000 prescriptions, and about 60% of that is of our specialty business. Our technicians aren't able to print labels until the correct product is scanned. We also have product images and notes for the technicians and pharmacists to check. The filling process in the fulfillment center starts with our OptiFill machine. We've nicknamed her Bertha, and she will drop a bottle and label it. She'll fill the oral tablets and then take a picture of the contents inside the bottle. Then she'll cap it and sort it and keep it into a tote so the entire order stays together through the process. Our Icon is an optical filling technology. It counts the tablets by camera, not by weight, which gives it a very, very high accuracy. Our pharmacists perform daily audits of our system and our processes. We also keep our refrigerators and temperatures on 2 separate 24-hour monitoring systems to ensure the product safety and stability. We have access to nearly all limited distribution medications, including cystic fibrosis, oral oncology, and rare disease states. Because of our large inventory, we have 2 designated inventory coordinators who watch all of our levels and do special ordering. In the fulfillment area, we have 6 pharmacists on duty every day, along with 15 technicians and clerks to assist with pickups for our patients who stop in and pick up at the pharmacy. When verifying the order, the pharmacist pulls up the prescription, and if it was filled by our OptiFill machine, it shows the picture that was taken at the end of the filling process. Once the order has been filled and verified by another pharmacist, it's ready to be packaged and shipped.
Shipping is a very important part in our process for the mere fact that they are time and temperature sensitive, and the cost of these medications are quite high, and we want to know where that package is anytime within its process. We use the major carriers. They are UPS, FedEx, US Mail, and also local couriers. We utilize a product from UPS called Proactive Response. That actually tracks that package from start to finish and maintains the integrity of that package through delivery. And with our courier service, we have the option to actually have that package delivered same day within an 80-mile radius of our location. All these services that we offer are no charge to our patients. We are very diligent in how we monitor and track our packages. Some of the differentiators, again, with our competition is the fact that we do have a local courier. That gives us the ability to really know where that package is, and also the flexibility to get that package anywhere we need to, same day, in 3 hours and 2 hours. We are fast enough to be able to react to that. So we had a customer that needed a medication the same day, and they lived outside our 80-mile radius, so we were still able to get that package processed and delivered, and the customer was very satisfied. We have developed a cooler that is 100% biodegradable. No more buildup of styrofoam coolers in our patients' garages. We use a special ice pack that is a non-sweating variety, and that just maintains the integrity of our package so that it does not damage the product we are shipping.
I oversee the therapy management clinicians, which include nurses and pharmacists, and their main role here is to help patients achieve outcomes in many of our different specialty disease states that we care for. We know that patients taking complex specialty medications face many challenges, including side effect management, the complexity of their drug regimen, and living with a progressive disease. Our therapy management programs provide individualized support to these patients. Pharmacists and nurses develop trusting relationships that positively influence patient engagement in their therapy. Our therapy management team breaks down barriers to keeping patients successfully on therapy, including triaging patients to your clinic when we identify serious adverse events. So we focus on adherence, adverse events, care coordination, and improving the patient's overall quality of life. Patients talk with our clinicians monthly at the beginning, and then based on the patient's needs, they will decrease their frequency typically to about every 3 months ongoing, depending on the disease state and the needs of each individual patient. In our most recent survey of all of our patients who receive therapy management services, nearly 2/3 responded in the affirmative that they feel that our therapy management services are making them healthier or helping them achieve their desired outcome so they feel healthier. Our therapy management team provides additional touch points with the patient. We provide added support to keep them successfully on the therapy you prescribe. We identify and break down barriers to medication adherence and alert you when patients report serious adverse events or when other issues with their therapies arise. We are here to support your care plan to help patients achieve the best outcomes. So we're able to leverage our therapy management programs to advance adherence goals, advance persistence goals, so patients stay on medications longer when they start them up for the first time, as well make sure that they're not completely lost to follow-up. There are circumstances where patients will stop a medication and not really tell anybody. They'll just disappear from the clinical landscape. And we want to make sure that we're following up with these patients, especially in that critical beginning, so that they are successful and so they can live healthier lives overall.
We appreciate the opportunity to work with you and provide outstanding care to your patients. I am very fortunate that I'm the manager of all these people that you've seen on this reel. They make up my team, and together we won one heck of a good operation here.
Thank you for taking the tour with us today. We invite you to come see us in person. Contact us for a live tour where you can learn more about what we can do for your patients and for your clinicians.